Thank you to the Focus Ultrasound Foundation for giving me the opportunity to present our research on osteosarcoma and histotripsy. Osteosarcoma is the most commonly occurring primary bone tumor in dogs. The primary tumor most commonly occurs in the appendicular skeleton of large and giant breed dogs. Standard of care treatment consists of surgical resection of the primary tumor via limb amputation or limb salvage surgery and chemotherapy. The most common cause of death related to osteosarcoma is pulmonary metastatic disease. Human osteosarcoma patients share many of these characteristics, allowing the dog to serve as an informative comparative oncology model. For both dogs and humans, standard of care treatment significantly impacts the quality of life in a negative manner, and prognosis is poor. And the prognosis has remained poor for several decades now, demonstrating the profound need for novel treatment options for osteosarcoma. The ideal osteosarcoma treatment option would target both the primary tumor and activate an anti-tumor immune response to help mitigate metastatic disease, which is the primary cause of death in osteosarcoma patients. In preclinical rodent models, histotripsy has been used to ablate primary tumors and has shown that it to demonstrate an anti-tumor immune response through the proposed mechanism outlined here in this diagram. Histotripsy will ablate cells, releasing tumor antigens and damage-associated molecular patterns and other molecules that work to activate an immune response, ultimately stimulating an anti-tumor immune response. Overall, if histotripsy could be employed for osteosarcoma treatment, this would help improve patient prognosis significantly, as it could serve as a surgical alternative for primary tumor treatments and also potentially stimulate an anti-tumor immune response to help mitigate metastatic disease. The objective of our current study was to investigate the possibility of using histotripsy to ablate primary tumors and also to investigate the immunological outcomes associated with histotripsy ablation in client-owned canines with primary bone tumors. For this treatment, canine patients suspected to have osteosarcoma with no evident metastatic disease were enrolled to ongoing clinical trials. Then, partial ablation of primary tumors was conducted with histotripsy, and then 1, 3, or 5 days post-treatment, the dogs underwent standard of care limb amputation surgery for the removal of their primary tumor. At this time, tumor samples from the treated and untreated regions of the tumor were collected for immune analysis. 2 weeks following surgery, patients returned for a follow-up visit. At these mentioned time points, blood samples were also collected for immune analysis. For this study, a 500 kilohertz 32-element custom-made histotripsy transducer and histosonic clinical histotripsy system were used. The system is depicted here in this picture, and more details can be found in the presentation titled Histotripsy Ablation of Spontaneously Occurring Canine Bone Tumors in Vivo, presented by Lauren Ruger. For immune analysis evaluation in this study, tumor samples and blood samples were collected. With the tumor samples, we preserved sample for histological analysis, differential gene expression analysis, and immune cell infiltration analysis via flow cytometry. PBMCs were isolated from whole blood samples to evaluate circulating immune cell populations and also to define the genetic signature and functional assessment of monocytes. Currently, of the 30 enrolled patients, 24 have been diagnosed with osteosarcoma. Regardless of bone tumor type, all patients that were treated, a successful ablation was achieved with histotripsy treatment, which can grossly be identified in images such as in images A and B. We also observed microscopic changes in ablated tumor tissue, mainly loss of cellular architecture and hemorrhage, as depicted in C and D respectively. Please refer to the previously mentioned presentation for more details on ablative outcomes. In tumor samples that were collected 1 day post-treatment, histotripsy treatment, we didn't observe any differences in mean CD4 and CD8 T cell populations between the paired untreated and treated tumor samples in these dogs. However, we did observe an increase in CD11B, CD14 positive cells, a mean increase, as you can see in graph B. Looking at the patients on an independent patient basis, we observed that either there was an increase in CD8 positive T cells or an increase in CD4 positive T cells in the treated sample compared to the untreated tumor samples, but not an increase in both of these populations, as displayed in graph C and D. In 4 of the 6 patients at 1 day post-treatment, we observed an increase in CD11B, CD14 positive cells in the treated tumor samples compared to the untreated tumor samples. We have made similar observations in our 3 day post-treatment tumor samples that have been collected thus far. In our 5 day post-treatment group, analysis and enrollment are still ongoing. Furthermore, differential gene expression analysis also supported immunomodulation changes in the treated tumor samples compared to untreated regions of the tumor. In samples that were collected 1 day post-histotripsy treatment, we used an array consisting of 90 genes related to cancer immunity and inflammation, and found that 28 of these genes had a fold change of 3 or greater in the treated samples relative to untreated samples. These genes collectively related to immune response, inflammatory response, response to stimulus, and cytokine receptor activity, further supporting the histotripsy-induced immunological changes within the tumor microenvironment as early as 1 day post-treatment. Further analysis at 3 and 5 day post-treatment for differential gene expression is ongoing. Systemically, we noticed that at 1 day post-treatment, we observed an increase in CD8 positive monocytes at 1 day post-treatment and also at 2 weeks post-surgery in this group. And this was compared to the healthy control dogs. The healthy control dog population were dogs that were age and weight matched to our patients. We also saw this mean increase in the CD80 positive cells compared to pre-treatment in this group. However, it was not as significant. And 3 days post-treatment, these trends were noticed as well, but were not as notable. In conclusion, we successfully delivered histotripsy treatment to the primary bone tumors in our canine patients, and no major clinical adverse events were experienced. Excitingly, our preliminary results suggest that we induced immune activation, immune modulation within the local tumor environment. However, we need to continue to further characterize these changes and establish their clinical relevance and better define this immune modulation that we have observed. To do this, we are continuing to enroll in our canine clinical trials and are excited about the potential data that the 5 day post-treatment group will offer us. We also have in vitro studies that are ongoing, looking at the primary canine immune cells exposed to histotripsy-treated osteosarcoma cells, And we have a similar study looking at mouse, canine, and human cells to investigate the response in all three species. Additionally, we have a preclinical orthotopic osteosarcoma mouse study, which will help inform this immune response and characterize its better. Collectively, our results and continued work are helping to advance the potential clinical translation of histotripsy for the treatment of osteosarcoma for both human and canine patients in efforts to improve patient prognosis. This work has been a collective effort of many people outlined here, and I'd like to say a special thank you to the Focus Ultrasound Foundation for their funding support, and also to all the canine patients and their dedicated owners.